Hello guys, welcome to the ICD10-PCS Coding Series. If you are new to the channel, please subscribe and follow the playlist from the beginning so that you understand all the root operations. This is part 39 of the Inpatient Coding Series, and today we will learn about the root operation replacement from group number 6 of the medical and surgical section in ICD10-PCS. I'm Vinay Kumar. I carry an overall experience of 20 years in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in completing their uh, medical coding certifications, along with gaining a lot of knowledge related to inpatient and outpatient coding concepts. I'm dual certified both from AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. At the end of this learning session today, we will have a better understanding of coding the root operation replacement from the sixth group of root operations. We'll also look at an example from the medical and surgical section. And as I said earlier as well, the medical and surgical section is the most important and the largest section in ICD-10-PCS. There are a total of 31 root operations in the medical and surgical section alone, and these root operations are divided into 9 groups based on similar kinds of procedures placed in a group together. Today, we are looking at the sixth group, which talks about root operations that always involve a device. There are 6 root operations in this group: insertion, replacement, supplement, change, removal, and revision. We already spoke about the root operation insertion in our last video. And today we are looking at the root operation replacement, which carries a character value of R. Root operations are the most important aspect of building an ICD-10-PCS code. So remember, root operations always define the goal or the objective of the procedure. Always read the definitions of the root operation and compare it to the procedure performed so that you get the correct code. Now, replacement. So replacement is defined as putting in or on biological or synthetic material that physically takes the place and or function of all or a portion of a body part. So basically it's about placing a uh, device. Okay. Now, the body part may have been taken out, replaced, or maybe taken out in the future, physically eradicated, or rendered non-functional during the replacement procedure. A removal procedure should be coded separately for taking out the device used in a previous replacement procedure. So, if there is already a device in place, and if it is removed today, then you might need to code for removal as well. Now, the objective of the procedure coded to replacement root operation is to place a device that takes the place or of some or all of a body part, which means it actually takes the place of a body part, but maybe partially. Okay, it also takes the function of a body part. Now, replacement encompasses a wide range of procedures, from joint replacements to skin grafts, of different kinds of skin grafts as well. Now, these are examples of the root operation replacement: total hip replacement, bone grafting, free skin graft procedures, phacoemulsification or cataract surgery with intraocular lens implant, heart valve replacements, and the replacement of cornea. These are examples of replacement procedure. Okay, now one important procedure you might need to note is phacoemulsification or cataract surgery with placement of an intraocular lens implant. Okay, now if a lens implant is placed along with cataract surgery, then you code it as replacement as the root operation. But the same procedure, the cataract surgery, if the lens implant is not placed, in that case, the root operation would be extraction only because we are only removing the cataract out and we are not replacing it with a lens. Now, this is an example of coding the root operation replacement. The patient underwent percutaneous lamellar keratoplasty with donor corneal tissue bilateral. So, this is a good example where you might need two codes because this is a bilateral procedure. Okay, and if you go back to the table and look at the table, you may not find a bilateral body part value. We look at the table in a while. So, now we need to code for replacement of the right cornea and also replacement of the left cornea separately. Two codes is what I'm talking about. Let's look at the table now. So the first code is for removal of cataract with placement of intraocular lens implant in the right eye. Section is medical and surgical. Body system is eye. Root operation is replacement. Body part would be right cornea. If you look at the table here, the right cornea and left cornea are available, but you do not have a bilateral value. So you have to code right separately and left separately. So the body part would be right cornea, which is 8. Approach is percutaneous 3. Sixth character for the device would be non-autologous tissue substitute because the corneal tissue came from a donor. So it was donor corneal tissue. We are taking it as non-autologous tissue substitute. And the qualifier or the seventh character would be Z. So the code would be 08R83KZ for the right corneal replacement. Now the second code is for the removal of cataract with placement of intraocular lens implant in the left eye. The same code, the only change is the body part value. Okay, section is medical and surgical. Body system is eye. Root operation is replacement. The body part value is left eye, which is 9. Approach is percutaneous. Device value for the sixth character would be non-autologous tissue substitute. And the qualifier would be Z. So the code would be 08R93KZ. This is the second code for the left eye. So the key points to remember from this video. This group of root operations always involves a device that is inserted, removed, repaired or replaced. Okay, we are talking about the group number 6. Root operations that always involve a device. For body part values, sometimes you may not have a bilateral body part value. In those cases, you need to code once for the left side and once for the right side separately. If you have a body, sorry, if you have a bilateral body part value, then one code would be enough to define the procedure that was done bilaterally. Next, another important point you need to remember is cataract removal with placement of a intraocular lens implant should be coded as replacement as the root operation. However, if the lens implant is not placed, then the root operation would be extraction only. You'll find the online version of the ICD-10-PCS coding book or the PDF from this link. I have placed the link in the description of the video as well. So go to the description and click on the link so that you can find the online version of the tables. Once you get there, you have to click on a zip file which will open up the tables and the index. Thank you guys. Thank you for watching. Please subscribe and support the channel. I'm trying to do a lot of videos on CPT, ICD-10 CM and ICD-10 PCS and will upload them pretty soon. Thank you.